So basically, to describe what heart failure is, I guess the easiest way to describe it is whenever your heart is being strained by outside ailments like heart disease or plaque buildup or like anything like that, it causes the heart to work way too hard, and then eventually it just fails. So um, yeah, it's basically the description of heart failure.
Hey guys, this is Majid, and these are things to prevent you from getting heart disease. Number one, know your blood pressure and keep it under control. Exercise a lot, don't smoke, get tested for diabetes, and if you have it, keep it under control. Know your cholesterol and triglyceride.
Triglyceride.
Dang. Okay, yeah. Triglyceride levels and keep them under control too. Eat a lot of fruits and vegetables. Maintain a healthy weight. Kevin.
Is that it?
Mhm.
So this is Majid. He's a heart. He's representing a heart, and he's pumping some serious iron. No pun intended. Well, yeah. Well, anyways, the iron I'm talking about is blood, obviously. So he's really efficient, you know. He's treating himself good. But then, one day, Majid's owner decides to give him some McDonald's. And he's eating it. He eats it, and then he starts... Yeah, he starts not running quite as well because it's one of those problems that causes heart failure. And yeah, see, and now he's failing because he got like diabetes or has plaque buildup in his arteries. So, and that's why you gotta treat your body right if you don't have heart failure. There are a few main causes for heart failure. The first is called coronary heart disease, or CHD for short. It's basically where a waxy substance, or kind of like plaque, builds up in your coronary arteries. And these arteries are used to supply oxygen-rich blood to your heart. So basically, when they get clogged up, it makes them narrow, and you don't get as much oxygen to your heart. Next is high blood pressure, which is pretty common in America, at least because everyone eats so many cheeseburgers. And yeah, that's basically, well, actually, everyone's really angry too, so I guess that's another thing. It's basically like when the blood pressure is forcing the blood through the wall or up against the walls of the arteries, and if this pressure stays high over time, it can weaken your heart and lead to plaque buildup. So yeah. When it comes to treating heart failure, there are two main options that a doctor's going to give you. It's either going to be medication or some kind of medical procedure. Uh, as for the medications, one of the most common is called an ACE inhibitor, and basically it's a drug that helps people with heart failure feel better by widening their blood vessels and allowing for less blood pressure through the heart. So it kind of lowers the heart's workload. There's also another drug called beta blockers, and basically these slow your heart rate and reduce blood pressure as well, um, and can limit or reverse some of the damage happening to your heart through a heart failure. Now on to some of the medical procedures. The most common is probably a coronary bypass surgery, and it's basically if you have severely blocked arteries from plaque buildup, which could contribute to your heart failure. The surgeon might recommend this, and in this procedure, basically blood vessels from your arms, leg, or chest are bypassed to allow a more steady flow of blood through your heart and allows less work that the heart has to do. Another really common one is a heart valve repair or replacement. This is basically if one of your heart valves is faulty from plaque buildup or something like that. And what they do is they'll either go in there and modify the heart or modify the valve to allow blood to flow more freely, or they'll replace it. And when they do that, they use a ring that goes around the valve and basically makes it where it runs more efficiently, and that's really only done if a valve repair isn't possible. So yeah, those are the main treatments for heart failure.